Hello, everyone, and welcome to the Babies in Common Show. I'm Jeanette.
And I'm Melissa. Welcome, listeners. Please note that any information shared during the show is not to be taken as medical advice. Please consult your own care providers for questions about you or your baby's health and visit babiesincommon.com/disclaimer to read more.
And also, a quick note before we start the show. As of today, our Stop Separating Birthing Families in Massachusetts petition has 1,065 signatures.
Woo!
Thank you for everybody who has signed and shared that petition. And if you haven't yet, please do that. If you're just hearing about this now, Melissa and I recently discovered that some Massachusetts hospitals are routinely separating a pregnant person from her only support for labor during triage, extended antepartum monitoring, and even some types of labor induction. Most hospitals in our Commonwealth do not do this. They're harmful policies, but there are some big hospitals that are doing it, and it's a violation of human rights. We're asking Governor Baker to issue an executive order to any hospital that's implementing these harmful restrictions so they can stop them, but we need your help. So please visit babiesincommon.com. On the right-hand side of the upper part of the webpage, you'll see a little button that says petition, and you can watch our video if you'd like to, and you can read the petition, sign it, and please share. We're hoping we don't have to get it to the governor's desk, that maybe we can compel these hospitals to stop before that, but we need more help. So thank you.
Yes, thank you to everyone who has signed and shared. And so now on to our show. Today is Wednesday, January 20th, 2021, and our guest today is my Yes, a big day. Our guest today is my former colleague and dear friend, Dr. Viveka Prakash-Zawisza. Dr. Prakash-Zawisza graduated from the University of Massachusetts Medical School in 2008 and completed her OBGYN residency at Stony Brook University Hospital on Long Island. She then completed a research fellowship in perinatal and reproductive psychiatry. In 2021, she began practicing as an OBGYN in the greater Boston area and has caught over 1,000 babies during her career, which is pretty impressive.
Yep.
And she was doing this until 2017, when she decided to leave clinical care to pursue an MBA at Brandeis University in order to pursue her passion for reproductive justice and policy reform in order to close the gap of healthcare disparities among at-risk populations through administrative action. So she is now the medical director of the MassHealth Payment and Care Delivery Innovation Division and the president-elect of the National Perinatal Association, which is a fantastic interdisciplinary organization that strives to be a leading voice for perinatal care in the United States, driven by a desire to give voice and support to babies and families at risk across the country. We are so honored to have you on our show. So welcome, Viveka.
Oh, thank you so much. It's such an honor to be here, and I'm excited to chat with you both today.
So we met when we were both working for Harvard Vanguard in Cambridge, Mass, which is now Atrius Health, in their OBGYN office, where I used to work as an office nurse for 4 years. And I remember forming a professional crush on you, wink, right away, not only because you were crazy smart, as we just learned, but because you and I definitely shared a similar philosophy of compassionate, family-centered OBGYN care. So what drew you to the field of OBGYN in the first place?
Oh, it's such an interesting question. And absolutely, the crush was mutual, just so you know, and it continues. You are truly somebody, no, it's true. I feel like you set a very impressive bar for what you do. So what drew me to OBGYN?
Thank you.
Actually, yeah. So it was actually my last rotation in medical school, and I knew I really loved surgery more than I thought I would, but I knew I didn't want to just do surgery. And then I actually really loved the family medicine model of care, where it was like this lifespan model, and OBGYN. Oh, and as you mentioned, psychiatry, I was very interested in mental health. And as you know, OBGYN is kind of all of those things. So
yeah.
if you allow time for listening, yes, it can be.
Yes. Well, and sometimes
right.
unexpectedly, right? Like you go into an appointment thinking it's going to be about one thing, and lo and behold, it's about something else entirely. So I think it was that. It's the variety. It's the fact that I could care for a woman starting from her adolescence all the way through menopause and beyond, and of course the magic of pregnancy and birth was just very captivating to me. So it was all of those things. It was just really encompassed so many things that I was passionate about within healthcare.
That's amazing. It's interesting that you went on for that extra fellowship, because I feel like I wish more healthcare providers in general, nurses, doctors, everybody, but especially OBGYNs, especially with the issue with around perinatal mood disorders that a lot of people suffer from, had more um, teaching and education in psychology and psychiatry. So I remember when I did my psych rotation in nursing school, we actually worked at a inpatient psych hospital in Holyoke that had like adolescent floor, like a detox floor, adult, even geriatrics. And I remember one of my fellow students was complaining, like, I'm not even going to do psych. I want to be like a pediatric ER nurse. And why do I have to be here? And the nursing instructor was like, if you're a nurse, every nurse is a psych nurse.
Yeah.
And that is so true because mental health is part of overall health. And, everybody would benefit from learning more about it. So
Totally. Yeah.
And you had you were an OB before you had your first baby, right? So
Yeah.
how was that experience? I hear from different people like, oh, like now you're
Yeah.
already catching babies and then you're pregnant. So how's that
Yeah.
experience for you as a doctor?
Oh my gosh, I know. It was so I'll be very I'm very open about this. So I actually, before I got pregnant with my daughter, I had a miscarriage, and that I would actually say was more transformative than my pregnancy with my daughter, just because it was an early loss. It was at 6 weeks, but it was devastating. And that actually made my heart so much bigger. Prior to that, when I was on call in the middle of the night, I'd get calls from women at 2 3 a.m, very early pregnancy with spotting, and I'd sort of I admit I would roll my eyes internally a little bit and sort of say, okay, like what am I going to do about this right now? Like, why are just you just have to sort of deal with it. I mean, I wasn't harsh when I spoke to them, but in my mind I was very sort of impatient. And then so going through that myself and grieving that loss, going through the physical experience of losing a pregnancy, that actually really, really transformed me. And so for that reason, I'm actually really grateful I had that experience, because I think it made me a much better provider. Um, but on a much happier note, once I was pregnant with my very beautiful, healthy daughter, that also, I would say in general too, I mean, that also really opened my eyes to how so many of the things our pregnant patients sort of tell us, like, being able to experience it firsthand. I was like, wow, yeah, like the nausea is real. Like it can be really debilitating. And I didn't really
it can be
appreciate
debilitating.
that.
Yeah.
Yeah. Like the aches and pains in pregnancy, the worry, right? Like every stage you're worried,
Yeah.
what's the genetic test going to show? What's this ultrasound going to show? Am I, going to pass my glucose test? And so, all of that was really, it definitely made me much more compassionate, and it made the job feel less like a job and more of like, oh, this is like a real thing that people go through. And, and I know, I also believe like you shouldn't have to go through something yourself to feel empathy for someone else. But I think it definitely makes your heart bigger for sure. So
Yeah.
yeah.
Yeah, I would agree. I don't wish infertility on anybody. If I look back at my life, I wish I didn't experience it. I had 3 losses myself before getting pregnant with my first. But I have to say that it had definitely enriched
Yeah.
my nursing practice, going through pregnancy, labor, birth, loss, postpartum depression, breastfeeding.
Yeah.
I didn't need to have cancer to work on the GYN oncology floor when I first got out of nursing school. I could provide compassionate care to those people. However, so you don't need to have a baby to be a good OB or a good nurse, but I just think it enriches. It did for me, and it sounds like for you, it enriches my understanding in a way that only firsthand experience can. So Jeanette actually always jokes like, "Don't you wish every like nurse and doula and doctor could have like a vaginal birth and a C-section and an epidural?" And like it would be nice if that could happen. Unfortunately, it can't. So learning from the firsthand experiences of others is important too. But all right. So can you tell us a little bit about your birth experience with your almost 3-year-old Saraswati?
Sure. Yeah. I have to say, I was very lucky. I had a very positive birth experience, and I think a lot of it was just having all the privileges I have, having an OBGYN who happens to be one of my friends, who I could literally just text on her private cell phone and say, hey, what should I do now? I delivered at Beth Israel Deaconess, where I had been practicing. I knew every nurse on the floor. I literally texted one of the nurses and I said, will you take care of me? And so, I mean, I had tremendous privilege that the average person doesn't have. But yeah, so my water broke in the morning. I had actually been contracting all night. So I was actually exhausted and I was lying in bed. And then I felt something coming out and I was like, am I peeing it's that classic thing. Again, see, right? Like Melissa,
Yeah.
like this gives you that like, oh, this is why people think they're peeing themselves.
Mm-hmm.
But sure enough, it was not pee. It was amniotic fluid and there was a lot of it. And
Mm-hmm.
but I felt fine and the baby was moving. And so my doc said, hey, just do whatever. So I hung out at home until that night. Again, the privilege where I knew, okay, shift change happens at 7:30. So I'm going to go in at 8:30 so that, everyone's settled and they have my room ready. So I was very lucky. It was all very controlled. I went in, I was already 7 centimeters, which was kind of
Nice.
crazy. Right. I mean, I was uncomfortable, but it wasn't that like huffing and puffing. I was like, okay. So they started to Pitocin and then I was open-minded about pain management. I sort of felt like, let me see how I do. But I was starting to get very tired. And so I made the choice, I'm going to get an epidural because I knew I had to push this baby out. I didn't know how long that was going to take. So I felt like the epidural would help me relax and get my strength. And it did, because I had to push for about 3.5 hours.
Oh.
Not a very large child. She was 7 pounds, 1 ounce, but
I feel like you're going to pay one way or the other. Fast labor, hard pushing.
That's exactly what I was thinking. Actually, Melissa, I was like, oh, I had this like lovely like dilation. It took hardly any time for me to become fully, and then of course 3.5 hours of pushing. But no, but she came out. She was healthy and vigorous, and got to do skin to skin right away. I did have chorioamnionitis, so because of that she did have to go to the NICU, but luckily at Beth Israel they really protect that first hour, which we know is so sacred. So they actually, I think it was more than an hour. They really stretched it. I think that the peds staff had to sort of come upstairs and be like, all right, guys, like we got to take her now. But so it was really great. And so then, yeah, we were separated briefly so she could go and get her IV and her antibiotics, but then she was right back with me. So I would say it was a very positive experience. I was very lucky. We all know how things can go, but yeah. So
Well, I'm
great.
glad to hear it. I wish that
Yeah.
every experience was
I
like that. And
know.
sometimes
Yeah.
people are like nervous, like to say
Yeah.
when they have a good experience,
Mm.
like
Right.
because people only tell horror stories. But I think people have to
Yeah.
hear positive,
Right.
experiences that,
Totally. Yeah. Yeah. And so I think you're right. And I think, I think it's also important to hear those good experiences, to recognize that like that's something that can happen and
Mm-hmm.
it doesn't have to be horrible and
Yeah.
traumatic. And so, yeah, I agree.
Mm-hmm.
Yeah.
So she's 3 now, right? You
Yeah.
said?
Almost 3. Yeah.
And you are having another,
Having
right?
another. Yes, I am
So
36 weeks and 1 day with my
one
second
day, who's
now. So
counting? Who's
not
counting?
at all, not me.
And you became pregnant during the
Yeah.
pandemic, so an
Mm-hmm.
official pandemic baby.
Official
And
pandemic
so what's
baby.
that been like for you?
Oh my gosh. The number one thing I will say is I'm so glad this is not my first
Mm.
pregnancy. I'm so glad this isn't going to be my first birth experience because
I feel the same way.
but it's true. I mean, I think you don't, what I'm really appreciating is how pregnancy is such a social event too. Like, so there's like this is going to sound really silly, but like there's little things like being on public transportation and having people like offer me their seat,
Aw.
um like, yeah, just like being out and about and sort of people holding open doors for you. I mean, and when I go out now, people like, oh, let me carry that for you. Like, it's silly, but like those things
Mm.
make you feel like, oh, people like notice that I'm having this special moment in my life. And so, and I know that may not be true for everybody, but
Mm.
I miss that. And yeah, just little things like that. And I think the piece I will say though that I think I am glad it's not my first pregnancy is having had and actually I had another loss after my daughter too. So as you know, those first ultrasounds are so nerve-wracking.
Mhm.
Luckily, when I was getting my like very first sort of viability scans with this baby, they were allowing people to come to appointments. So I had my mother with me, which was such a godsend, because now they're back, at least at Beth Israel, you can't have anyone with you for an ultrasound, which is really hard. I mean, we know like ultrasounds are not always happy.
Yeah, no, it's totally devastating.
Yeah, yeah. And so that's the part. And just in general, like, like my husband hasn't been able to come to any of my prenatal appointments, and like he loves being able to listen to the heartbeat. So actually, because I'm an OB, I bought one of those like home Dopplers, mostly for his sake, so that he could hear the baby. So, things like that I think have been kind of a little bit sad. But on the other hand, again, it's not my first baby, so that doesn't feel as bad. But it's been very bizarre. It's very strange. So yeah.
And
Mm.
it's okay if the answer to this question is no, but have there been any silver linings to kind of being pregnant in quarantine?
Yes. Oh my gosh. So the biggest silver lining has been the fact that I can work from home, and so in the beginning, that horrible nausea, that intense fatigue, I could just hang out in my like lounge pants on the couch during a meeting and turn the video off and literally be like horizontal on the couch. So I always thought about that. I was like, oh, like obviously there's no way I could have done that if I was still in an office.
Mm.
Also just the commute, like we live in the suburbs and I work in my role at MassHealth, I work downtown Boston. So it was driving to, the Alewife garage, taking the red line in. It
Mm.
was a long commute. Don't have to do that. So things like that, I think definitely I got very lucky in that sense, that like I can attend to my physical needs in a way that I wouldn't have been able to pre-COVID. So yeah, that's definitely been good.
Do you feel like you're preparing for this baby's birth any differently than you did with your first?
Yes, I am. And I would love to chat about that, because I think that has been the biggest piece. So I had pretty, I would say, moderate postpartum anxiety after my daughter was born, and not knowing if that's going to happen again this time, if it will be potentially worse or better. And with the pandemic, I think one of the things that I'm anticipating will be really hard is not having the visitors, because that really helped me last time. I think in general, having your whole routine blown up by a newborn, that was like the root of my anxiety, just not knowing what was going to happen next. And so having like each day I would have like at least one or two friends scheduled to come by, so at least I knew like, okay, this person's coming at 2 o'clock today, I'm going to shower and put my clothes on.
Right.
We're not going to have that this time.
Hmm.
So I hired a postpartum doula, and I've
That's what I
Oh,
was
hired,
gonna say.
good.
Good, good,
yes,
good.
and
Yeah,
she's
yeah.
amazing. I am so happy I found her. I've hired a lactation consultant. Actually, Melissa, I don't know if you remember, you helped me a lot when I was,
I do. I remember it well because one
yeah.
day I was helping you, you called me, and I was at Chuck E. Cheese with my kids. And I'm like, I got to take this call. And Paul's like, what? I'm like, breastfeeding emergency.
Yeah. 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 No, Melissa was so helpful. And I have to say, Melissa, you were so resourceful without being judgmental, which is really what I needed, because I had a breast reduction. And so I just didn't know. I had sort of already decided in my mind I wasn't going to produce any milk, but I
Mm.
was producing milk and just didn't kind of know what to do with any of it.
Yeah,
Yay.
yeah.
So I have hired a lactation consultant this time, and she's wonderful. Um,
Wonderful.
Yep.
yes, and I
Planning
also,
ahead. I love it.
yeah, I have also am working with a perinatal mental health worker as
Mm.
well, and so I have all those. I've had appointments with all of them. They're all teed up for me, and because I knew I again, just having the privilege of just knowledge and past experience and seeing other people go through things, I knew I'm going to need a good team
Mhm.
postpartum.
Yeah,
So, but yeah, the first time I didn't do any of that. I was like,
yeah.
oh, this is fine. I wish I had, but not to say that I couldn't have used all this help before. Hindsight is 2020. So, but
You
yeah.
hear that, everybody who's listening? If you're
I
pregnant,
know. I was just going to say the
set
same thing.
yourself
Jeanette
up.
and I say it in class every time. And I think just, you cannot, you cannot even comprehend
No.
the way in which your life so drastically changes. We shouldn't even say that it changes after having a baby. A bomb goes off in your life. There's
Yeah.
shrapnel and everywhere, and you're trying to get through it. Like it's
That's
not at
yes.
all the same.
No.
And traumatizing in a way. Like
It
I
is.
was
It is.
traumatized by my
Yeah.
loss of self
Yeah.
after having a baby, and nobody had really described it like that to me. People were just like, oh my God, babies. Oh my God, I remember when my babies enjoy every moment. I wish that my babies were still babies. And you're expecting like, yeah, you're gonna have diapers, yeah, you're gonna have sleepless nights, but like I got this shit in the bag, and I did not have it in the
No.
bag, spoiler alert. And
No.
I paid for it in a
Yep.
big way. So
Yep.
yeah, I mean, it's so important. It's even more important to prepare for postpartum than it is to prepare for labor and birth. I mean, I have a giant bumper
100%
sticker
agree.
on my minivan that says peace on earth begins at birth, because
I love
why
that.
wouldn't I believe it is
You
an
have a
important
lot of bumper
transformative.
stickers
I
in your
do.
car.
I also have one that says meconium happens instead of shit
Yes.
happens. So
Yeah.
but yeah, I mean, it's a bomb goes off in your life,
Yep.
and you have to figure out how to rebuild a new version of you
Mhm.
that's a healthy version of you.
Yeah.
So I'm super excited to hear you're preparing for postpartum.
Yeah.
And I hope everybody listening knows about these things and considers it, because
And
it's
I,
one
yeah.
thing to like write it down, like, oh,
Mm.
I'm going to write down Jeanette's name and I'll know to call her after. It's another thing to do a prenatal breastfeeding consult with Jeanette, to talk about your breastfeeding goals, and then like know her, see her, meet her.
Yeah.
And then it's so much easier to text, or even just like
Right.
attending one breastfeeding support group. Pregnant, they're all virtual now. You could do it on like a lunch break, and kind of just like overcoming that barrier that of
Yeah.
doing something new when you're
Yeah.
so overwhelmed by life.
Yeah.
I remember I would not have gone to Jeanette's breastfeeding support group. Jeanette was my doula when I had my first. I wouldn't have gone to it unless she like was incessantly texting me like, come to group, come to group, come to group, come to group. And I was
You're
like,
right.
I can't. I came up with 1,000 excuses. And she was like, I don't even care if you have pants on, just come to group.
Yeah.
I did. I showed up in
Yeah.
like pajama pants, like with like
Wow.
tears streaming down my face.
Yeah.
But it was
Yeah.
life-changing to have that support. So
I have a question for you though. So you have already had a child, and you're a doctor, and you have an MBA, and you're a professional, and you have a husband. Tell our listeners, what on earth do you think a postpartum doula is going to do for you?
Oh.
Right?
Well,
Because we
yeah.
know they're going to
We
we
do a
know what they're
lot,
gonna do.
right? So like
Yep.
you're on top of everything. You already know what to
Oh yeah, of
expect. And you
course.
don't
Right.
have like a 15-month-old that's going to I mean 3 is not it's not huge. It's not like you've got a 10-year-old. But, I mean, it's not just to take care of your child, it's to help you. So, yes,
Yeah.
expound upon that so people can learn why they should
Oh,
do that.
yes. So everything you just listed about me is true. And none of the things you just listed are the sort of, what am I trying to say? An objective, loving third party who can sort of, I'm allowed to swear on this show, right?
Yep.
Who can,
Yes.
who can kind of call you out on your shit,
Yep.
Um, So with my postpartum doula, am I allowed to say her name on here?
Yes.
I would love
Yeah.
to plug her. Her name's Amanda Hem. She's
Yes.
amazing.
She's on our
You
show
know her?
coming up
Oh,
soon.
We're gonna
well,
have
there
her
you
on our
go.
show.
I'm obsessed with her. So she has been emailing me ever since we sort of met, and she wanted to have a phone call, and we did, and and it's honest. I will actually say it's because of everything you just listed that I can be kind of a know-it-all, and I can be kind of like, well, here I know this is happening, but here's why, and it's fine. And she was like, I would need you to do something for yourself. I need you to just stop. And how are you resting? How are you preparing your body and your mind? You're about to give birth. And I was ready with one of my like quippy quick, like, well, it's fine, and then I was like, oh, okay. So that's what it is. It's that person who just cuts through all of that and is literally just there to hold you.
Yeah.
And I think as women in general, we don't let ourselves be held. We say, nope, I got this. I got to handle it. I got to hold the whole world together. I'm not allowed to like not hold the world together. And I actually think we need other women usually to say to us, no, let it go. just, you don't have to hold the world up.
Yeah.
And I kind of feel like that's what she does for me. So,
Mhm.
which nothing else you just listed
Right.
do that for me. So
Yeah.
that's why I think every woman, every birthing person should, needs that person to give them permission to just look after themselves. And that's why I wanted to work with her.
And are you choosing to work with her in person or virtually or both?
Yeah, it's a great question. So, the one thing I really appreciate about her too is that she believes in COVID and believes
Yes.
in science, which is lovely. And so we've had very transparent discussions about that, about each of our sort of risk factors and bubbles. So we have, for now, we'll see what happens, what's happening with, the world around the time I give birth. But we have decided that I would like her to come in person. I do feel like
Mhm.
that. Physical presence will be really healing.
Mhm.
We've chosen that we'll stay masked, but I do think that if it's safe for her to come into my home, I would like to.
Mm.
But I think the nice thing is I could also just text her or call her if I
Mhm.
Right.
needed her help. So yeah, and actually the same thing with my lactation consultant, who Michelle Stolo,
Mhm.
who you may know
Yep.
her.
Yep.
So she also has said she's willing to do either. So I might have her come in person the first time just to make sure I know, like I look like I know what I'm doing. But then as I said, she's also been very available, via phone and email as well. So
Sure. Yeah.
I
yeah.
think that,
That's
that's a
good.
conversation that all expecting couples should have, as like, who can we safely bring into our bubble for this
Yeah.
time? Like, because
Yeah.
there are risks to bringing people into your bubble, and
Yep.
I'm not telling anybody what to do, but I also know that there are so many risks to not having any help at all, and
Yes.
so we have to
Yeah.
also weigh that. Like,
Yeah.
could your family, is there a special person in your family, or could you hire a postpartum doula that, like, you feel comfortable with their level of safety and social distancing and quarantining, that you could have come and help, or we've even been tossing around ideas online, Jeanette and I, through the Babies in Common Facebook page, of how are people supporting expecting families during this time of social distancing. We've gotten a lot of good ideas, like just do, actually, Cherie,
Yeah.
your best friend, she was like, do the ding dong ditch with some dinner, and I love that. I'm like, I'm gonna adopt that phrase,
Yeah.
like, ding dong and ditch the dinner on the
You can do that with
the
laundry
stoop.
too. Like
Yeah,
pick
exactly.
up a
Like,
basket of laundry, fold it, and then bring it back home.
right, pick up, or just calling to checking in, texting without any expectation that they're going to text back. Like, whenever I text a new parent, I always write, I send funny memes and gifs, because that's like my thing, and I'm always like, you don't have to ever respond back, just know I'm thinking about you.
Mm.
And the joke is, like, you have at least a month to return text messages once you become a parent.
Oh yeah. Right.
Yeah.
Right. Absolutely. Yeah.
Find ways to, if your family can't throw you a real baby shower, can they do a virtual baby shower? Can they set up a meal train for you? Can they
Mhm.
Mm.
can they all give money for a postpartum doula, right? Like, can we think
Mhm.
outside of the box? Because
Mhm.
just because we're in the middle of a pandemic doesn't mean that people don't need support. They need even more support. So we just
Mm.
have to be
Yeah.
creative. I
Yeah.
see a lot of people online saying, like, well, I don't know what to do because I can't go over and hold the baby. It's like, well, that's not the most supportive thing you can do for someone who just had a baby anyway.
Mm.
Right, right, exactly. Totally. And so my husband and I actually had very much that conversation, that like sort of risk benefit. And, I think this has happened to all of us in varying degrees in different ways. But I sort of, about every 2 months or so, ever since this started last March, I sort of hit my like COVID wall. And I just have like 24 to 48 hours where I'm just not in a good place mentally. And I just have to
Yeah.
sort of mourn things, grieve things, feel angry, all of that. So I was due for one, and that happened a couple weekends ago. And then I said to my husband Jim, I said, look, I am going to need someone. I need Amanda and Michelle to physically come into our home, because I am not going to do well if I can't have human contact. It's just going to be too much. And he said, okay, like we'll take that risk. That's okay. And so you have to be able to say that and say, like, I can't do this. I can't. And Zoom is not the same. And having like that physical presence, and even I would love to be able to like hug her or have her hug me if that's what I physically need. And I'm willing to even like not do that, but just having her like physically in my house, I think is going to make such a difference. So yeah, absolutely. I think mental health is, you have to be honest about the risks, but you can't sacrifice everything.
I find hugging the knee is sometimes helpful.
Oh, a knee hug. Yeah, just a
Yeah.
little touch.
Just
I
reach
love it.
across and squeeze the knee. If you
That's
can.
a good
No.
idea. Physical touch is
Yeah.
so
Oh,
important to me. Like
yeah.
sometimes this is so funny. I have a friend who's a early intervention developmental specialist, speech and language pathologist, and she had some funny thing on Facebook like that she's gonna hug everybody she sees after this pandemic because she's so hug deprived. And I typed under it, I was like, this is my secret confession. I sometimes lay on the ground and I have my kids pile on top of me just to feel the pressure of their bodies. And she was like, "Oh no, that's a thing. Like deep pressure, like sense,
Yes.
like that's a thing that people. That's why
Those
people buy weighted
blankets.
blankets.
Those
Yeah."
are
And I'm like, "Oh
so
my
for
god!" I was
sale.
like, I
Yeah.
thought I was super weird because like sometimes I was just like, "Hey, Piers, can you like lay on top of like I'm on my belly, obviously, on the ground,
Right,
but like,
right.
can you just like pig pile on top of mom and like let me feel this deep pressure?
Yeah.
I am so hug deprived."
I know.
Aw.
It's so true. And I same, like physical contact is huge for me. And yeah, missing that. So on that note too of like like deep confessions, I am actually actively looking forward to when I get to be admitted to the hospital in labor, because I will need to be touched by a nurse. Like
It's
literally,
so
I'm like,
true.
even I'm like, oh yes, you can put my IV in. Like, please touch my body and put in a big needle. I just want to feel your skin. Like, this is so creepy and weird, but I just want to be like therapeutically looked after by somebody, and
Mm,
so it's a little bit nutty to like look forward to going to the hospital, but that's the times we live in.
Yeah,
whatever
even if you're an
floats your boat.
introvert, we are a social species. So, I think that we all, need to give lots of hugs after this pandemic is over
Oh,
and fill up
yeah.
our hug bank again.
Yeah, totally. Yeah,
Yeah.
I agree 100%.
Maybe we should all pick one person who can be part of our bubble that's the designated hugger.
Oh, yeah, that's such a good idea. We should totally
I
do
have
that.
I have besides my husband, I have 2 teenagers and both of them are very good at giving hugs, so I get lucky because I have teenagers, but
Yes.
yeah, I can't
That is
imagine.
awesome.
Yeah, yeah. Goodness.
So, in preparation for this show, I know I received a lot of inquiries about the coronavirus vaccination and pregnancy. People are very, interested in learning more about this. They have their concerns, as anybody would with something so new. And as we mentioned in your introduction, you are no longer in clinical practice. But if you were working on the front lines as both a doctor and a pregnant person, our listeners are curious: would you choose to receive the coronavirus vaccine, and why or why not?
Yeah, absolutely. I'm happy to address that. And I know you already gave a caveat at the beginning of this, but these are my views, my opinions. I don't expect anybody to agree with me, and everyone has to do what's right for them. But I would 100% get that vaccine if while pregnant. I believe it's safe. I also think the risks of having COVID while pregnant are far greater than any even theoretical risks from the vaccine. Obviously, as we know, unfortunately, scientific trials are prohibited from enrolling pregnant people due to ethical reasons. I hope that changes at some point, but we just don't know. And so the data that we have on the vaccine it's all just going to be anecdotal for a little while as pregnant people get it, and then we'll know. But I believe it's safe, and I would 100% get it if I could.
Well,
Yeah, and yeah.
oh, sorry, go.
No, I was just going to say, I mean, I think, obviously it's no secret that, and I always say, again, this is my personal opinion. I do think that this whole, you know, hesitation, skepticism around vaccines is it's a very American thing. I was born in India and was raised there as a young child before we left. I've studied global medicine. I've worked overseas in health settings. Let me tell you, this is an American thing. People who live in countries where infectious disease is very difficult to control for various reasons, they don't think twice about it. Uh, Adults will walk miles, they'll bring their children for life-saving vaccines. It's not even a question. And I think because, ironically, in the United States, our public health system is so robust, we enjoy for the most part, not everywhere, as we know, we enjoy clean water, clean air, access to healthcare, access to good food, healthy, clean food, that now we don't really think about infectious disease the same way. And it feels like in something kind of optional. And it's sad that even during a pandemic, people think it's optional, but I think it is this mindset that I have observed in my work across the world that is, it's a very American phenomenon. So I get it. And and I'm not trying to be disparaging. I think, again, I respect everyone's viewpoint, but I think it's important to place it in context of, you're pretty privileged if you feel like a vaccine is the most dangerous thing you could put in your body. So yeah, that's how I'll leave it at that.
I do hope that I know it's not going to change everybody's mind, but the fact that we are experiencing a global pandemic, and I definitely am not trying to get political with this statement, but I hope that at least some people will realize that we can't just put America first, that we have to really think about how we are all an interconnected people. And, it doesn't matter if we vaccinate everybody in the United States. We need to make sure that people all over the world get access to this vaccine. We are all, if this could not be a better real life, terrible experiment of how we all need to, have some altruism and sense
Yeah.
of community, right? We do not live in a bubble. We are a global community in 1,000 reasons, economics, health, et cetera, et cetera.
Yeah.
So I hope it changes some people's mind, but I'm also a wishful thinker.
Yeah. I love the way you guys are talking about this. And Melissa, I don't even think I told you about this, but I heard that when the what happened? When the vaccine first came out and there were, multiple different agencies and associations in the medical world and the global health world that were making statements about what they thought the theoretical risk might be for those who were nursing or pregnant. And then there were some people in the more naturally minded, but still medical doctors world that were putting out statements on their Facebook pages. I ended up sharing on our social media, Babies in Common, here's what this person said. Here's what this association said. Here's what this person said, right? I didn't say that you and I had opinions about it. I just said, here's what they're saying. And I was told that people apparently were surprised that I even posted that.
Oh, wow.
And I was like,
we're all about giving information at
I
Babies in
literally
Common.
didn't say one way or another what I thought or what Melissa thought. I just put the information. Here's what these people are saying, because people want to know, like, what are the people saying? Like, yes, you can go search it yourself, but not everybody knows who the Academy of Breastfeeding Medicine is. Right? They have no even clue what that is. But then I'm like, oh, here's this one organization that's in the world of breastfeeding that here's what their opinion is for the moment, and it's just so interesting because I absolutely, am working on my opinions on those things for myself, but I don't need to share those with people. But at the same time, like, it's all about learning more and making your decisions for yourself and your family. And this is like you guys are saying. And Viveka, I lived in West Africa for 2 years. And so I was working on vaccine campaigns there as well. And it's, what you're saying is so true. It's just, the perspective, and it is a pandemic, and these are decisions that are challenging. And of course, there's other ways, like staying at your house all the time, that you can you can avoid
Right.
Sure. Yeah,
this
that's
illness.
absolutely a choice.
But this is different, and
Yeah.
everybody's going to make their own choices, and I haven't made mine yet, so I don't know. But I wouldn't. It doesn't matter what I decide. Ultimately, I'm not even going to share that. I'm not going to be one of the people that post a picture to tell people whether I did it or not. Because it's our personal decision. But it's important to read it all and think about it all, and it's great that you're sharing. As well.
I do also, I want to help people understand that just because we don't have studies on pregnant women or breastfeeding women with something like a vaccine or a drug or anything. This comes up in breastfeeding medicine all the time, Jeanette, right? Whereas because pregnant people, breastfeeding people are often excluded from clinical trials, we don't have any studies, quote unquote, especially randomized controlled trials, because those are unethical. You can't say these half of the people get an epidural, these half don't. Like that trial would never go. That trial would never work.
Right.
So, we don't always have studies saying, is, let's say, Zoloft safe for a breastfeeding person. But what we do have is an understanding of the science and pharmacology and, the molecular biology of it. So we might not have a study that says, Zoloft is safe in breastfeeding, but we do know the molecular weight of Zoloft, and we know the protein binding of Zoloft, and we know these other things that can tell us medically, scientifically, is this going to cross the barrier into the milk, right? So we don't always get the luxury of a study, but we also have science. So again, I'm not telling anybody whether to get the vaccine or not, but when you see people, on Facebook that are getting their shot as a breastfeeding person, like, we don't have any studies on that. We're never going to have a study on that, right? We're never going to have a study on that. And so these people have to make this choice. They're working on the front lines. COVID has its own risks. And so we do understand that RNA, for example, like the component of this vaccine, disintegrates in the gut. It's not something that it goes away, right? So we can understand the pharmacology and the science of something, and that can give us some understanding as well. And I feel like every person should, of course, I think we all agree on this, have the right to make their own determinations about what they put into their bodies, what they do with their bodies. But we also hope that everybody, and I think this is where Jeanette and I come from a lot in class. We don't care if you get an epidural or have a cesarean, or we don't have any skin in the game. We just want you to have access to evidence-based, truthful, scientific information when you're making those decisions. Like when I worked in upstate New York, for example, I worked with like a lot of teen patients, and like 16, 17, 15-year-olds, whatever. And they would always come in and I'd say, what are your plans for pain management? And they'd be like, well, I ain't getting one of those epidurals because it's going to paralyze me. And, there are 1,000 reasons not to get an epidural. I had a home birth, right? Like, I think there are many good reasons to perhaps avoid. Epidurals have risk, just like any other medication, but it's not going to paralyze you. So if you're going to make a choice to get 16 doses of narcotics in labor because you're afraid an epidural is going to paralyze you, I want you to make a choice based on good, solid evidence and scientific information. So, my question to you then is, there's one big myth that keeps coming out there on the internet, that the coronavirus vaccine attacks the placenta and therefore it will cause infertility and miscarriage. So again, I understand that you are not a biochemist, but you're definitely a scientifically minded person. Can you speak to why this theory, is scientifically and physiologically inaccurate?
Yeah, happy to. Yeah, and I'm not a biochemist, although I did study it in college and to some degree in medical school. So there's actually some really great explainers out there that vary in how sophisticated they are, and I'm happy to share links with you both. But from my understanding, the reason this myth emerged was that, as you mentioned, Melissa, so this vaccine is it's a new technology. It's instead of what most vaccines have is some piece of the actual virus in them, and that might be a living virus. It could be what we call an attenuated virus, or meaning it's weakened in some way. But this virus for COVID is new in that it doesn't actually have any of the actual coronavirus particles in it, but it has the DNA building structures that make the virus. And so what that mRNA does is when it enters the cells of your body, once you get the vaccine, it tells your cells to start creating the protein that's on the surface of the coronavirus itself. And they're called spike proteins. And what the concern was is that some of these spike proteins are very similar in structure to some proteins on the human placenta. And so that's sort of where this all became a thing, that, oh, well, now your body is going to make antibodies to the spike protein from the vaccine, but those antibodies can't tell the difference of coronavirus spike versus placenta spike. And so they're going to attack your placenta and you're going to have miscarriages and so forth. So firstly, I think the reason why this is not true is that this is not actually going to happen is that many women have been pregnant during this time. The last, how long has this one been a thing? I think it's been over a year now since coronavirus emerged. There have been women pregnant all through their pregnancy, starting from conception to delivery, who have had COVID. We are not seeing reports of increased rates of miscarriage, of stillbirth, or just in general of placental dysfunction. There's some anecdotes, as you both know, you go on the internet, people are going to write scary things, but nothing has emerged to meet the standard of an actual like publication of, oh, hey guys, we're noticing a pattern here that pregnant women are who have COVID are having placental issues. So that's one. The other thing too, and again, I'm not a biochemist, but my understanding from my reading is that these spike proteins are actually fairly common, and so they not common in the sense of like that they're all over the place, but that the ones that the coronavirus vaccine produces are, there's enough that the body can tell a difference, is my understanding. And so those antibodies will be specific to the coronavirus spike and not to any other type of spike. So that's my understanding so far. As you say, is no one can study this, right? Like we can't see what actually happens to a bunch of pregnant ladies who got the vaccine and a bunch of pregnant ladies who didn't. But my feeling from my understanding of the science is that it's a myth. It's not actually going to bear out, and hence why I would 100% get it myself. I will say, I think in general, and I say this as a practitioner, I do encourage more caution in the first trimester. So I think if you had asked me this question in my first trimester, I personally would have chosen maybe not to get the vaccine at that point. But again, I'm speaking as somebody who's lost pregnancies before too. So I was, very nervous in those first 12 to 14 weeks. But I think, once things are sort of established and the pregnancy is going well, I think the risks, as we know, do diminish pretty consistently. So that's my long quasi-scientific answer. But there, as I said, there's a lot of good stuff on the web written by actual scientists who study this. And I have found most of it to be pretty readable. So the information, as you said, the information's out there. So you just have to be careful about what you consume and where it's coming from. But I have not seen anything that makes me worry.
Well, thank you.
Yeah, that's good. I know there's people who in the lactation community who are saying, hey, I just chose to get the vaccine. Isn't somebody studying this? And there are people that are looking at breast milk at least. And so those studies are out there. I could get my hands on them if people wanted them. Links to them so you could sign up. And I wonder, have you heard, are there people, I would hope so, are there people who are looking and tracking people who are pregnant who got the vaccine?
Yes. Yeah. So Pfizer, Moderna, both of these companies, they have pregnancy safety registries. And so they're inviting anyone, depending which one you get, you go to the website for that company. I have not looked at this myself, but this is my understanding, is that they have links, and you can say, again, it's all just, it's observational data,
right?
But you can sign up, you can say, yes, like this is how many weeks pregnant I am, this is the dose I got. And then you're supposed to report, it's all self-reported, but you can say like, oh, these are my symptoms after the first dose, my symptoms.
Have you heard of any non-pharmaceutical company who's doing that? So it's a third party?
So not that I know of. I think in general, these registries tend to be run by the companies themselves for pregnancy. But it's a good question. If anything, the NIH would be the one that was doing something sort of as a third party.
I mean, the Vaccine Injury Center.
Yep.
Would always be happy to hear whatever people need to tell them.
Yes. Yeah. Although I think the you know how it is, people who might report things there, those are going to be biased towards negative experiences. I think the beauty of a pregnancy registry is that it's just neutral.
Yeah.
So
right, nobody has experienced any injury. They're just registering that they're pregnant, and then and that's actually true for any medication, my understanding. I know that when I worked in the office, we'd have sometimes pregnant clients that had to be on like certain seizure medications that were like not a good, they were a pretty high risk category for pregnancy, but they had to be on them. And so, we would always encourage them to register, because if you have made the choice that the risks of not being on this medication outweigh the risks of being on it, and you happen to be pregnant and you're taking it, and you would be willing to share your experience, it can help a lot of people. So that's something to always consider.
And this is part of how we've now, by 2021, got so much great research on different medications and lactation too.
Yes.
Because people are willing to share their experiences, and maybe there was no study whatsoever, but there's just not enough case reports that show negative reactions, so they can write that up.
Yeah. Exactly. Yeah. And I think you are correct, Melissa, that it's, especially for psych drugs, that's been my experience too, is with psych drugs. So um, yeah, because they have no other way of knowing. And so yeah, I think you're supposed to then report back like what was your birth outcome and what, what was your
Right.
baby's health and so forth. Um, so yeah, so I mean, I think they need that data, and so they need people who are pregnant to get the vaccine, otherwise we're not going to get data. So yeah, I
So,
think the people who are pregnant who are getting, well, anyway, in most states in this country, everyone is doing the phased timeline with high
mm,
risk people first, but so I think we're seeing pregnant physicians and nurses who are
right.
getting it. So I think I'm really curious. I'm hopeful there's going to be some good data and it'll show that it's safe.
And also, if you get the vaccine and then you find out you're pregnant,
Mm,
that might be
Yeah,
something to consider,
right.
joining the registry for.
totally. That would be really
Right.
interesting to see. Yeah. But yeah, I mean, I think we know that there's still so much we don't understand about this virus, but I think it's very evident that it attacks blood vessels in kind of this weird way.
Mm,
That makes me worry even more. You want to talk about placentas? I
right.
mean,
Right.
placentas are these incredible organs that are just blood vessels. And so it worries me more to get a virus in my body that's going to specifically attack that.
Mm,
That scares me way more than the vaccine would. But again, this is the information that most lay people don't know. Like they don't understand these things necessarily, and so it's so easy to just click on something on the internet and go down some rabbit hole about the vaccine. But I think as much as we can, and I'm so happy this podcast is putting good evidence out there, and hopefully people will, listen. And I believe as a practitioner, everybody should educate themselves. And I've always said, I do not know everything. I will never know everything. It's not my job to know everything, but my job is to share with you the best information I have. And ultimately it's your choice what you do with, as you said, Melissa, it's your people's choice what they do with their bodies. And that's, I firmly believe that. Um, but I also can't sit by and let people be miseducated. So you can make whatever choices you want about yourself as long as you're consuming accurate information. So that's my job, is to make sure you're getting accurate information.
mm,
Well,
Yeah.
knowledge is power.
Yes.
That's what my motto, Schoolhouse
yeah.
Rock.
So, any final thoughts about being pregnant during a pandemic and
Man. Yeah.
recommendations for people?
I mean,
Encouragement?
I think, we've said this, and I would just emphasize it in general about this pandemic, whether you're pregnant or not. It's really hard. And I
Hmm.
think, again, as somebody who advocates for women and who is passionate about building women up, I think we, especially as a group, are vulnerable because we feel like we just have to hold everything together all the time. You do not have to hold everything together. Please reach out for help if you need it. I'm sure on this podcast you guys have talked about many resources, and I think we all have to get over that sense of, I'm strong, I don't have to ask for help. It's okay, you're still strong. Actually asking for help is a sign of strength, so please do that.
Hmm.
And yeah, as you said, like you could, on paper I look like somebody who should have like everything figured out, but I don't. I really don't. And I'm still a human being, and I struggle, and I get anxious, and I get sad, and I get angry, and we all need help getting through those things. So especially during this pandemic. So I really want people to feel connected and feel like they can be connected even when we can't be like hugging each other the way we really wish we
Exactly.
could.
Well, thank you for normalizing
Yeah.
getting help.
Humanizing.
Yeah,
Yeah,
humanizing, getting
it's
help for
huge.
sure.
It's huge. Yeah, absolutely.
Wow. Well, yes, thank you for coming. And if you want to learn more about Dr. Prakash-Zawisza, did I say it right?
You did. Yeah, you got it.
Zawisza, right. Work with the National Perinatal Association. Visit nationalperinatal.org.
Yes,
And we
lots of
hope you
lots of COVID resources on that website too.
Oh, good.
Yes.
Yes, and I look forward to I know that the conferences got all messed up in 2020. There were so many
Mm.
conferences I got refunded. I cried tears getting the check back because I'm such a nerd. I love conferences.
Me
But
too.
I can't wait for the next one, the next National Perinatal Association. Hopefully we'll see each other there and can hug in person.
Yes, I look forward to that too.
We hope
Mm.
you have all enjoyed today's show, and we hope you will tune in again. Remember, Babies in Common is a community for you. After all, we all have
Babies in common.
Thank you so much for listening. Thank you, Viveka.
My pleasure.